I've been receiving a lot of emails and phone call inquiries from people wanting to know more about how to construct a mirror box for phantom limb pain. So I thought I'd put a little video up of me actually making a simple mirror box using nothing more than a cardboard box, a mirror tile and some sticky tape. And the only three things you need. You don't need scissors, there's nothing to cut. It's just this tile here just came from a bathroom store. It's a standard bathroom mirror tile. It's one of the things people stick on a wall. It cost me about £1.50, if probably less. The cardboard box is just a standard cardboard box, and the tape is just standard tape. These are the only three things you need. There's nothing fancy to it. They're just demonstrating the box is a normal box. Fold in, or if you want to, just cut off the flaps there, just fold them in. And then taking the tile, here it was pure coincidence that these two things fitted roughly the same size. You want the mirror to be as much the same size as the end of the box as possible, although it's not that important, as long as it's as near as you can get. Now all you're going to do is tape the mirror, obviously with the shiny side outwards, otherwise it won't work, to the end of the box. And just secure it well with the tape. And now you have a ready-made, fully complete mirror box which you can use to treat phantom limb pain. Now the style of use here I'm about to demonstrate. Turn the box on the side and be sat facing the box. Don't work at it looking down on the box. I'm going to demonstrate what happens with that later on. Now the hand nearest you, the hand that you can see nearest the viewer, imagine that's the existing limb. The one that's going in and out of the mirror box is actually the phantom. So imagine that hand that's waving now doesn't exist. That's the one that's been amputated. So what the person is doing is putting what appears to be what is the phantom into the box, and the real hand is reflected by the mirror. The reason the box is there is to obscure the fact that there is no arm actually in the box. It is to help aid the illusion that in fact there is a limb in that box, but it's just obscured. So now here we have a different angle. And as you can see, it can be quite a convincing illusion, because obviously what you're seeing there is the reflection. So that is what the amputee would see. Obviously there's a hand now going in, but obviously that's the limb that's in the box that is the phantom. Now what you want to do is make sure that the phantom is positioned in the appropriate distance. So you haven't got one arm that's way off in the distance and one that's really close, because the reflection won't match what the person kinesthetically or at a feeling level actually experiences. So the illusion, the visual illusion, needs to match what the person feels is happening. Now I'm going to demonstrate what happens if you, instead of sitting side facing the box, you work at it from top side down. And the difficulty here is the angles, but also when the person is facing down into the box, there is no value in having the box, because you can see there's nothing inside the box, because the illusion there isn't being created. So this is the way to not do it. This simply won't work. It may work, but it won't work so well. You want to be tricking the brain that there is a limb going in and out of the box. So this is the way to not do that. Now what I've done here is just change the camera angle so you can see it from pretty much the way the user would be looking at the reflection. You want to lean over from this position, lean over as far to the left as possible, so you're looking at the mirror rather than seeing what's in the box. And as you can see, one mirror, one box, some sticky tape, and there you have Ramachandran's mirror box.